So welcome everybody again to this meeting on September 6th, 2023 of the Franklin County North Quabbin Community Health Improvement Plan Network. We're really glad to have you here. I'm here with Phoebe Walker, who's one of our co-chairs, and lots of familiar faces and also some new folks. So our plan for today is to do a little bit of kind of a like forest style overview of what the CHIP network is, where we are in our current plan, and then to spend most of the time today getting input from you on what might be in our next community health improvement plan, which is going to launch in 2024. We've been working on getting that started this summer with help from many of you, and this is part of that process. So we're pretty excited about that. And I am gonna share my screen now, so you won't I won't be able to see most of you for most of this meeting because I'm going to be the screen share, but Phoebe will be able to see you.
I will see you.
and hopefully we'll divvy up the responsibilities in a way that makes it not too awkward. I feel a little out of practice with Zoom. It's
Isn't that a great thing to be able to say?
Yeah, it's kind of nice. All right. So here we go. Okay, so that's just the cover slide to tell you where we are. And then, so here, this is to give you the big orientation about the CHIP network and what our vision is. Got some pictures of some of the activities that have been happening recently, including presentations, mobile markets, speeches, lobbying, and at the State House, all kinds of different things. And, you know, your examples in the icebreaker really encapsulated this vision that we have, that, you know, what a healthy community looks like is a place where people have the opportunity to pursue healthy lifestyles and to achieve all sorts of well-being and to participate in shaping the systems that affect their health. Phoebe, I can't remember how we split this up. Am I doing these slides? Okay, so this slide is to give you a kind of a big overview sense of what our CHIP network is. We have a map that shows what we mean by Franklin County in the North Quabbin, which is the 26 towns in Franklin County and 4 towns in the North Quabbin region. And what I want you to understand is that our CHIP network is about people. It's a network of people. We have about 300 people who are connected with the CHIP network through email and communications, and about 100 who are actively connected with the work currently right now. And those people are individuals, they're volunteers, they're workers, they're parents, they're staff at organizations that are actively working on health, all different kinds of things. And if you want to introduce yourself in the chat to give us an idea of how you identify and where you're coming from, that would be great, so that other people have a sense of who's here in the room with us. And I also want to make sure to acknowledge that we have a really fantastic steering committee that includes representatives from many of the local institutions in our area that are working on health and health equity in different ways. So all of their logos are there on the screen, and quite a few of our steering committee members are here with us today. So if you want to identify yourself as a steering committee member in the chat, that would be great. Or you could put a symbol on the screen or wave, maybe raise your hand so that folks can see who the steering committee members are right now, because we really appreciate your extra work and leadership for the CHIP.
You're here. Thank you, steering committee. And Lynn is waving.
And Lynn Feldman is our new co-chair from LifePath. So this one is to help you have a sense of what the CHIP network is working on and how the CHIP plan, the 3-year CHIP plan, fits into that. So for those who have been to CHIP network meetings in the past, you've probably seen part of this image before. this part in the middle that has the sort of connected circles. So we just talked about how we have this steering committee, and then our current 3-year plan, which we are now calling CHIP 2.0, has 3 goals. Those are the ones that have the green titles, the circles, and each of those goals has a working group that's associated with it. We also have an ongoing health equity data working group that existed from the beginning of the CHIP back in 2017. And we have a separate project that's also under the umbrella of the CHIP that is about improving housing to improve health. And all of those projects are funded by the Massachusetts Community Health and Healthy Aging Funds currently, and have in the past been supported in very important ways by Bay State, and now are also being supported by the Massachusetts Department of Public Health and Office of Rural Health, which we are working with as representatives for the Rural Vaccine Equity Initiative, which the name is a little misleading because really it's about rural health equity in a lot of different ways. It's the funding came because of wanting to make sure that COVID vaccination access was equitable in rural areas, but the funding and the support has allowed us to work with other colleagues who live and work in rural areas for community-based organizations all across the state. And that circle has some small circles because that funding has also enabled us to do some mini grants in the last year or so. And I think that there are several people here who we've connected with through those mini grants and who are doing work with those mini grants. So maybe some of you could raise your hands and then we can see kind of who the RVEI additions to the CHIP network are, or people who we've strengthened our connection through RVEI. And then another part of our work is this advocacy piece where we've developed a legislative agenda to work on with the state legislature during our current session, which we're halfway through because Massachusetts has a 2-year legislative session. And so that's an important part of our work as well. So that's what the CHIP network looks like right now, like in, second half of 2023. And then Phoebe, I think you're up for this.
I am up to say, so that's the network, right? That was a little picture of the network, and the network is named what it is because it is also a plan, right? So there's 2 completely separate, not completely separate, but connected things. You're the network, you're members of the network. And then we have a plan that is this is a national model that exists all throughout the United States, and different where communities pull together to create sort of collective goals around health improvement on a 3 or 4 or 5-year cycle. So one of this picture here is sort of a little flow chart that shows how that process works and how it starts over again. And you're going to be seeing these squares as we go through this meeting where we talk about, what phase of this process are we in. But we always start with actually rooting in the data, right? And in many communities, that's just the community health needs assessment from the hospital. In ours, we also draw from the other forms of data from the Communities That Care Coalition, from Community Actions work, from Life Paths work. So we pull from a wide variety of goals, but we are always rooted in the overarching hospital community health needs assessment. Then we spend some time thinking about what the best strategies are to address the needs for our region. And in many cases, those are strategies already identified by people in this room doing health improvement planning in like one sector or another. And then we develop down, I realize I'm using my mouse, but you can't see my mouse. Then we develop a big plan, right? A 3-year plan where we try to figure out what is going to happen in this region. And that includes also who's going to be working on it. In some cases, it might be Jen or me or the steering committee. In some cases, it's someone else who's working on that work, like Atlas Farm is working on mobile markets. Just Roots is working on mobile markets. They're doing that work. So all of us have pieces of this plan. And the working groups vary on who's leading that working group, who's sponsoring it, who's involved in it. And then we meet and we measure and talk about how we're doing, and then we start over. This is us starting over today in this little green box. Okay, you can go on to the next slide. So this just shows our very first chip that some of you were around for, was this big document that, and there's an example of the poster of it here. And then the one we've been working on now had a sort of a narrower focus and a bunch of different ways of coming at the issues that we wanted to handle. And we are still wide open on discussing what the next one looks like, but it will span 2024 through 2027. So that's like what the network is, what the plan is, and how it will draw from many other regional plans, and from all input from folks like you. So now on to what we're actually here to talk about. Go ahead, Jen.
So just to give you an idea of what the rest of the time is going to be like, we're going to do pretty quick check-in about where things are at with CHIP 2.0 and how we're going to wrap that up. We're going to check in about our legislative priorities work. I'm going to make an announcement about the Massachusetts Community Health Equity Survey. And then we're going to dive deeper into gathering more input on our next CHIP. So I'm going to do the CHIP 2.0 piece, which is going to be a very highlight kind of overview. This is the part of our plan where the working groups are really kind of taking the lead, and what that looks like varies depending on the work. So our current CHIP has 3 strands of work. One is about healthy eating and active living, and that group meets quarterly. And is really a meeting of people who are interested in that topic and want an opportunity to be able to share resources, give updates, ask for advice. And over the last few years, it's been an opportunity really to both amplify and accelerate and push forward on some of the goals that we put in our original plan, which were related to complete streets and mobile markets, for example. And also, we've created some new opportunities and activities for ourselves as a result of that work, including we've done more work on closing the SNAP and HIP gap than we were expecting. And we didn't know at the time that we made our CHIP 2021 to 2023 plan that we were going to have the opportunity to be able to do a huge regional project on age and dementia friendly work. And so that has turned out to be something that this group is very actively involved in a lot of different ways. The Community Supports for Young People work group is a new group that is sponsored by Communities That Care Coalition, which is the coalition that really takes the lead on all of the strategies in the CHIP plan that have to do with prevention and harm reduction for young people. And the Community Supports for Young People group is itself a strategy that tries to address a gap. And the gap is that there are working groups through Communities That Care and other organizations that bring together parents, that bring together educators, that bring together young people themselves, but there are not very many opportunities for people whose work or personal life involves supporting young people to be able to do that kind of networking and sharing of resources and agreeing on common strategies. And so in this CHIP cycle, we created that group and launched it. And that group has had a pretty significant emphasis on mentoring, which was a strategy named in the CHIP plan, and also was influenced by the fact that we had a co-chair who worked for a mentoring organization, Jennifer Webster of Big Brothers Big Sisters Franklin County, who has now transitioned to a job for the national Big Brothers Big Sisters. And so she's going to step down, and we're going to have a new co-chair in our next round. And then our third strand is about mental wellness and resilience, and also really significantly about peer support. And that group hasn't been meeting as frequently, met quite often early on, and decided that they were really interested in trying out a curriculum that was about developing individuals' skills for responding to crisis that would kind of embody all of the values that this group had around wanting to strengthen resiliency, capacity for peer support, building social connectedness, reducing stigma. And so what this group did was it sponsored an initial cohort of a dozen people who took the 12-hour training, and then laid the groundwork for a large cohort of staff at Community Action and youth at Community Action youth programs to also take the training. And so during this CHIP cycle, we've seen about 50 people in Franklin County gain this skill set. So those are some of the highlights of CHIP 2.0. We're going to have a more deeper dive into CHIP 2.0 at our November meeting. So this slide is to give you an idea about some of the things that are coming up. The work groups are going to be having, what will probably be their last or second to last meetings for CHIP 2.0 in their current form pretty soon. Healthy Eating, Active Living is meeting next week. And then Community Supports for Young People is meeting on September 20th. And then we're going to do a survey of the folks who did the emotional CPR training to sort of see a year out, a year and a half out, how that has stayed with them, and get a sense of what we might do next with that strand. So we'll reconvene the mental wellness and resilience group to talk about that later in the fall. And then, as I said, at the beginning of November, we have a CHIP network meeting scheduled where we're going to highlight some of the CHIP 2.0 outcomes. And then after that, we'll do a printed report that will be sort of our report on CHIP, the last CHIP. So that's a overview of what's going on with CHIP 2.0.
And what's going on with our legislative priorities? Well, as you may know, our legislature takes the summer off after they finally get their budget passed, which happened quite late this year, latest in the nation, but it did get passed, and it had a lot of good stuff in it, and also some pretty damaging vetoes as well on the part of the governor. Then that's still under negotiation and reconsideration. So they just got back into the office. You can see here a little bit about our priorities, which span a bunch of different bills, and also note that these are legislative, budget, and administrative priorities, because, for instance, in our work regionally here in Franklin County to try and improve access to housing, a lot of the folks who are doing that work are really trying to change how the state grant program works, for instance. So it's not a legislative action, but it's a very important administrative change. So let's just start quickly at the top there. In terms of our healthy aging priority, there were two very similar bills, and one of them got a hearing, and we were able to provide testimony on that, and I know others in the network did as well. It is still sort of stuck in committee. under the Safe and Affordable Housing. Both the Rural Policy Advisory Commission and a Western Mass Coalition are working on a bond bill, a housing bond bill that's supposed to be coming up, which would, bond bills are not legislation, but there are ways to drive significant investment or create new programs or really well fund existing programs. And all the sort of the various bills that we were tracking are all still in their committees. In terms of a strong local public health infrastructure, that bill also had a hearing, and we also provided testimony there, and still has not come out of the committee. There was a pretty significant cut in the budget, and there is a request to override the governor's veto on that. And in terms of healthy families, we were collectively supporting the providing high quality early education bill. Has not had a hearing yet. The larger effort called the Common Start Agenda did have a lobby day, and the governor also vetoed some things in here that Community Action is extremely concerned about. And Becky, do you want to talk about that or put any information in the chat about the request?
I think I can share the documents I shared with you folks in the
All
chat.
right. Okay, put them in the chat. Great. That'd be great. Okay. So if you would like to keep those citizenship muscles limber and get in touch with your legislator, Becky's about to show you what that is about. And then in terms of transportation, the sort of Regional Transit Authority bill has not had a hearing yet, but there has been some pretty promising new funding in the budget. And we're just going to let in our friend from the YMCA, Stacy Bauman. So that is the legislative, administrative, and budget priority update. Does anyone else have something they want to share from the budget or legislature around relevant legislative action? When I was teaching college, we were told, wait 8 full seconds.
Well, Phoebe,
Yeah.
I have a question. So how likely is it if that the legislator will override vetoes? Like, how does that work?
I think it's very likely that many of them will be overridden, but not all of them. You know, they have to get back together and they have to vote them individually. So they're back in action there now. And I think this is one of the #1 things they're working on, according to the Senate president in the Globe the other day. So I think it will be over relatively quickly. And then the fact that we have 2 years, a 2-year session, means that in terms of these bills that haven't gotten anywhere, it is not time to give up hope. That said, Massachusetts also does file almost more bills than any other state in the nation. And we never get to, you know, even a huge chunk of them never even come to having a hearing. So it's great that some of these have already had hearings. That's really important. And that's sort of the next step in legislative advocacy, is to get in touch with these committees and ask them to hold a hearing on the priority bill. And there is a small group of people who sort of identified themselves at the beginning of this year as being interested in sort of being updated and getting information on when to call and what to do. So if you want to join that committee, put that information in the chat. And if you're already on it, you'll get an email in the next week or two that sort of tells you, who reminds you about who to weigh in with to move some of these bills along.
Yeah, I should have said that about the CHIP work groups too. You know, if you have heard about anything that you're interested in knowing more about, or you would like to make sure to be invited to a specific meeting and you don't know if you're already on the list, just shoot me a message with your email and tell me what you want, and I'll make sure that you get that information. We're trying not to deluge you with emails and invitations to things that you don't want. And I don't know whether we really quite got the balance right. It's one of the things that we're definitely thinking about for our next iteration of the CHIP is, you know, how do we cast this broad net and tell everybody about everything, and also make sure that people get just what they want, because we know that you're busy and you have lots of things that you're working on.
Agreed. And Becky put some stuff in the chat. Do you want to say anything about it, Becky, or?
Sure, just that some of the vetoes that the governor made were detrimental to early education providers, especially those with subsidized or low care for low income children with families with low income, and also like supporting educator salaries, which is like one of the biggest reasons that we are like having very little childcare like in many areas, because we can't we don't have enough operating funds to hire the staff that will work for like a pittance. Basically we need to increase that. So anyway, so those are some of the important things. And there was a veto that specifically targeted Head Start supplemental funds, which is just bad. All bad policy.
So if that is something you would like to get involved in, everything you need is right there. And basically what happens is legislators have a lot of different vetoes to choose from, to override, right? And it's helpful for them to hear from their constituents about which ones are important to them, just like it is for a bill. So I think that's it for the budget and legislation, unless, and so moving on, our final thing before we get into Chip, the third Chip, is to talk to you a little bit about the Community Health Survey, also known as the Community Health Equity Initiative Survey. I'm assuming many of you have already received multiple emails from various entities, either through the Franklin County Resource Network or DPH. I see Mike nodding. About this survey, but now is my chance to tell you to fill it out and share it with your friends, and share it on social media, and share it with the participants in whatever worlds you move in, because this is, we have some experience here in this county of what it means to have good data, right? We've got communities that CARE has been surveying young people in our region for 20 years, and to be able to look at that data and see what folks need is so important to our ability to plan well together and to meet needs. And this is pretty much the only version of that exists in Massachusetts for grown-ups. Well, anybody 14 and over can take it, but it is a way that DPH will think about how they allocate resources, where they give money, where they think about what kind of people need what kind of help, and in particular what rural Massachusetts looks like compared to not rural Massachusetts. So I can't really stress enough how great it would be if you could make sure more people fill this out. We're getting weekly reports from the state about how many people have filled it out. There are a lot of small towns where there still haven't been very many people. There's a lot of different demographics that haven't filled it out. And the way that data works, as people may know, is if you don't have enough numbers, they won't give you the data on that group of people. So for this survey, that is 30. So every possible category of person in a town, there needs to be 30 of that category for us to actually see the data. So we have some money here. We have tablets. We have money for incentives. If people have ideas about events where you're doing it, where an incentive would help somebody sit through the 15 minutes to fill it out, because it's not nothing. It's those of us who filled it out were surprised at how much they wanted to know. And then and we also have tablets that have the survey preloaded on them. And so if you have an event where you think like people who are comfortable using tablets are going to be there, we're happy to lend you, 4 or 5 tablets that people can fill them out. So that's my my pep talk on the survey. And Jen and Alana Gurjoy from the 4SC Coalition in their latest newsletter sent out a special incentive, which is if you take a screenshot or a photo with your smartphone or whatever of the last page that says like, thanks for filling it out, and send it to Jen, you'll be entered in a raffle for multiple $50 gift cards for Franklin County dollars. So thank you for listening, and please fill it out and have your children and your neighbors fill it out.
Kemma and I are also working on an incentive structure where if you take one of those tablets and give out and have people fill out the survey on the spot, we are trying to work out some kind of coupon or gift certificate that people can get right then and there. So that's an alternative to entering a raffle for a $50 prize. Maybe you get a coupon for $5 to the co-op or $3 to get an ice cream. And that makes it worth spending 10 or 15 minutes at the farmer's market or at Stone Soup Cafe to answer some questions about your health. So if you're interested in helping us do that outreach for the survey, absolutely let me know. And I'll try to facilitate whatever will make it easier for you, because we would really love to get more. So we got 1,000 responses from Franklin County on the last version of this survey, and we would like to beat that this time.
We were winners last time.
Yeah. We're probably gonna only be allowed to collect responses into October. So we are at about 200 now. So we've got a ways to go, although we are winning so far for the rural clusters.
All right, enough on that. Thank you.
Okay, sure. Okay, so I'm wondering if people have any questions or comments before we dive into the next section. I'll wait for a few seconds to see if anybody. All right, so let's move on. So our next chip is going to use this, here I brought us back to that process chart that Phoebe walked us through before, because we're going to show you how we're using this process now again. So this chip will again be a 3-year plan. And so as you're thinking about what we might work on, I encourage you to try to think about things where we could really see something happen in 3 years, where in 2027, we'll be able to report back and say, look, we said we were going to do this and we did, or we said we were going to do this and it went a different way than we were expecting. But many of the things that we're working on will take more than 3 years to accomplish. And for a chip particularly, it's good to have things where you can see change happen in that time frame. We do have a new community health needs assessment from Bay State Franklin Medical Center, which was published in 2022, but many of us kind of got our official introduction to it a couple weeks ago at an event in the Allen Room downstairs here at the FERCOG. And Brittany Rosario, I think you're here, right? Did I see your name before? So I'm going to put you on the spot, Brittany. There was this lovely sort of at a glance booklet that got distributed at that event. And I know we talked and you said that you were going to have a digital version of it. Can you give us an idea about when that might be available?
Yeah, so we are just looking to, so we have 3 out of our 4. We're waiting to finalize 1 more for our hospitals. That should be done by early next week, actually. So the digital copies should then be all cleared and approved. So I can send that out to you probably by next Wednesday, maybe 1 week from now, if all goes well with that 4th iteration.
Awesome. So on the next slide or 2, you're going to see the cover of the full community health needs assessment for Bay State Franklin Medical Center, which is a massive, awesome report created by some of my colleagues here at the FERCOG with a great deal of help from many others. And it's really interesting. It's full of data and analysis, but it is daunting. So this other thing that they created for the event a couple of weeks ago, I thought was a really nice kind of introduction. And I'll make sure that that gets shared with the CHIP network as well. The other highlight I want to tell you about CHIP 3.0 is that we kicked off this process by having our steering committee spend an afternoon with us. And It was really wonderful to be able to get together in person in a kind of retreat style setting with them. And we had great conversation and came out of that conversation with some direction from them based on what they're seeing in their organizations, what they're seeing in the community, what they're hearing from their clients. And we really spent a lot of time talking about what are the benefits that having a chip brings to our community. How does having a chip make us stronger? What can the chip do to help? And we came out of that event with more clarity about how in the next cycle of the chip, what we're hoping is that our network will be able to help all of the different efforts to improve health in our community with three things: increasing community engagement, which is something that we've focused on in our current chip and really been supported and pushed on by our current funders, the Community Health and Healthy Aging Funds. And so it's exciting to be encouraged to continue and deepen that work. We recognized that there's a great deal of interest and a huge need to focus on reducing isolation, and that is true across many different populations and demographics, and that having a stronger network of connections is one of the most powerful protective factors that people have for being resilient and for improving and maintaining their health. And the third thing that we heard from the steering committee is that the chip really adds value in part through its role as a Franklin Regional Council of Governments initiative in the part of our work that is about making the case for rural health equity and helping folks, whether they're funders or they're legislators, understand that there are some unique challenges and some unique advantages for rural areas. And there are some ways in which the solutions that have been created and have been very successful for places that are more densely populated don't work here. And that we have crafted some great solutions that we would like to be able to share and to continue. So we will help to continue helping our partners make the case for health equity work in rural environments. So that is kind of where we started. And then I wanted to give you a quick look at what the community health needs assessment produced, because this is kind of our starting point. And as Phoebe said earlier, we're fortunate to be in an area where the needs of our community and the data that we have comes from quite a few different sources. So this is one, and it does aggregate some of those other sources, but it's not the sole source of data that we use. But it is a starting place. And what I think is important to know is that the prioritized health needs based on data that were identified in the community health needs assessment for the Bay State Franklin Medical Center area are pretty familiar to us. They are not different than the prioritized health needs were back in 2019. The pandemic did not change them. And none of these things have gotten better enough that they have gone off the list. In the Chenal, there is a deeper look at housing needs and at provider scarcity and at youth mental health, which is because those are very important health needs, but the other things are important too. So if you want to sort of see the basis for why these are the health needs and what this means in terms of numbers and with more nuance, the report is great. And Phoebe, I don't know if you can put the link to the report in the chat.
I already did it a few slides ago. Yeah.
Great. But it is really terrific and is worth taking a look at as an overview, as are the other needs assessments that I'm going to mention as we go along. So the other piece of the TNA is that it gives us a starting point for identifying priority populations. And I think Phoebe's going to talk about this part.
Yes, but I'm going to hustle through it because I
Yep.
know we want to get to people's input. So mostly here just to say that a community health needs assessment is also a standard thing that happens around the country. And one of the requirements is that it list off people who need extra investment, people who have been subject to historical inequities, people who we need to make sure that everything we're doing is taking folks into account and having these people at the table. And so this is the list from that 2022 Community Health Needs Assessment from Bay State Franklin. And I guess one thing I just want to point out is how many of us fall into this category. This is a lot of our region, and many of us are multiple of these things, right? Intersectionality is a very real part of many of our lives. And also that this list is generated based on data that's available. And of course, many people fall into categories where there aren't enough people in rural communities to make them be visible in the data. So for instance, it's very hard for us to get any information about Indigenous people in our region. And so there are obviously people who are missing from this list, right? But this is the list that is in that community health needs assessment. And I think Jen and I are showing you these two slides because we want you to be thinking about them as you give us your feedback on what we should be doing in the next CHIP. Okay, go ahead, Jen.
Okay, so here's how we're going about making this new CHIP. This is the part where we're identifying the best strategies and we're developing our plan. So as I said, we started with the steering committee retreat, and then we're moving on to getting input from network members. We started that this summer with an in-person meeting that several of you were at, where we brainstormed and we used the Robert Wood Johnson health factors model that we've used in previous CHIPs to sort of generate a lot of ideas about different ways that we could make progress on health in our community in the next few years. And we also have been spending a lot of the last 2 months doing research and outreach to partners, gathering plans that already exist, reading things like Community Action's Great Health Assessment, and contributing to Communities That Care Coalition's new strategic action plan, participating in the age-friendly strategic planning process, and basically familiarizing ourselves with as much of the information about what's going on and might be going on in the next few years as we can, so that in October, when we have a steering committee meeting, Phoebe and I will be making a proposal to them about what we think CHIP 3.0 will look like. And then kind of concurrently with that, we're also reflecting on and evaluating how our last CHIP went and what we learned from it, and trying to integrate the learnings and this is something that really needs to continue, and that piece of things into our thinking on the next CHIP. So once we have a draft, we will find some ways to make sure that partners and the network are able to review that. And then, see, now I can't see it because it's under my thing.
Oh, no, go back one.
I totally messed it up.
It's okay.
See, how do I go back? I'm going to stop and I'm going to go back the other way. Sorry, friends.
I think you can actually just go on to the other slide.
Yeah, I have to get back to sharing them because I lost my cool. Not that I feel like I have a great deal of cool today to begin with, but
Well, what we're doing next is we're asking you to use the
yes.
same tool that we used at the beginning at the icebreaker to give us feedback into the new chip.
Yes. All right. So anyway, all I was going to say about the plan is that we will launch that new chip in January. And that's the point where you can expect that we'll have a written plan. But all of you are warmly invited to be involved in the review and the shaping of which strategies we choose, how work groups will work, how things will be scheduled. Please just reach out to me if you feel like we aren't reaching out to you enough. But, oh crap.
There, I have the link in the chat, so I think you can probably take that down and just share your screen.
Okay, great. But now what we want to do is we do want to get your input. So we're going back to that platform that we talked about, that we tried at the beginning with the icebreaker, which is called a Padlet. Except now, this time, what we're asking you to do is to think about what your ideas are for efforts that we might amplify and encourage, and gaps, places where there needs to be more energy in the next few years in order to make progress. And to make it a kind of a manageable task for us today, I chose 5 topics that have emerged as key topics in the JNA and in other conversations that we've had. These aren't all the topics that we might cover in the next chip, but they are just helpful for organizing. And I think that you'll find that you can make a lot of things fit into them. But
can you scroll down to show people the topics?
So one topic is provider scarcity, which providers means like providers of healthcare. And you can define healthcare broadly in your mind. And the next one is housing shortages. The next one is demographic and environmental change. So that includes both changes in human populations and also changes in our environment. The next one is community connections. So that is intended to kind of encompass community engagement, community connectedness, civic engagement. And then the last one is transportation options. You might have ideas that fit in more than one category, and you can put them in more than one category if you want. So this is set up to give you a lot of different ways to engage with it. Phoebe put the link in the chat. So if you click on that link, you will see it and you can spend some time reading it and looking at what other people have said. We took a selection of the ideas that we've heard so far from other people. It is by far not comprehensive. And so I tried to kind of pick things that came from a few different angles and that would give you a representative sense of what we've been hearing about. But rest assured that there's way more where that came from. And it's been really, really cool to hear from people about what their ideas are and also what their projects are. So just reading is fine, but you have a few different ways that you can interact with this Padlet. You can add new ideas. So one way is doing the double clicking on the background thing that we did before, but also if you go to any of these plus signs, if you click on the plus sign, it will create a new post for you. And then whatever you type in the subject line will be at the title. You can leave it blank if you want. Whatever you write here will be in this part. And if you want to link to something, you can do that here. You can add pictures, you can link to files. You can also comment. So as we did in the icebreaker, if you read something and you have an idea that you want to add on to, you can make a comment. And if you read something that you really resonates with you, give it a star. If it super resonates with you, give it 5 stars, right? what I'm hoping is that each of you will spend some time here making some marks on this document. Leave us some signs of what you're thinking and what you would like to add. We will see up here how many people have contributed, and I'm excited to see that number grow. Your comments will come up as anonymous unless you create an account, Padlet account, or you sign your comments in some way. So we'll see a lot of anonymouses. If you want us to know that it came from you, you should make sure that your name is in there somehow. So who's ready to give it a try? I see people are starting to jump in already. Other thing that I can do is I can create a breakout room here in this Zoom. If there are people who prefer to kind of work in a group and would like to talk as they go, we can make a breakout room and go off in that room so that we can chat while the people who prefer to work individually can kind of do it on their own.
So are you going to make that breakout room and then people will choose it by hitting more? And
yeah, I think that's
okay,
what I'll do.
all right,
So,
I will stay out here, but if anybody is having like the thing isn't working for them or whatever, and you want to, or you just want to talk,
or
with
the,
me,
or you're just a
Yeah.
you know, a verbal processor more than
a clicker.
yeah. Yeah.
Then you can go in the breakout room with chat.
All right. So let's see, I'm gonna let participants choose a room. I'm gonna create one breakout room.
All right, and I'm gonna stay here and click away. So it's like, imagine it's like a quilting bee in the days of old, but we're all in a bunch of different places. So we're sewing something together.
Before I disappear into the breakout room, I am not, I don't have a sort of closing piece for this meeting. Phoebe, as long as you're comfortable with it, I kind of feel like I'd like to let people kind of do as much as they want to do and then head off on their own.
Yeah, and one of the beauties of Padlets is that they stay open, they stay there. So if you just go to your whatever internet you're in right now and write the word Padlet, this will pop up as one of your options. And